Good morning, everyone. We will get started. It is 11 o'clock. Thank you all for joining today. Really grateful that you took the time out of your schedules to meet with us and learn more about the National Council on Administrative Fellowships. So today's session will be for both graduate programs and fellowship sites interested in membership. If you have questions throughout, feel free to put those in the Q&A. We will have some time at the end to go through those questions, but we'll collect those as we go. So my name is Jen Krafosnica, and I am the program manager for the National Council on Administrative Fellowships. And with me today is Troy Trainer from the University of Pittsburgh Medical Center. Troy currently serves as the Director of Women's Cancer and Specialty Services and is also the chair of our NCAF steering committee. So thank you, Troy, for being here. Good to see you. So today we will give an overview of both the National Center for Healthcare Leadership and National Council on Administrative Fellowship, go through some of the benefits, the value, and a bit more detail on our code of good practice. And then Troy will speak a little bit to the membership experience from a couple different angles. We're lucky to have someone that's been in different areas of NCAF and as an applicant, as a fellow. So I hope we can provide a good sense of the value of an NCAF membership for your organization, your students, fellows, and faculty. So we'll get started here. A little bit about the National Center for Healthcare Leadership, or NCHL as we like to call it. We are a nonprofit that promotes evidence-based leadership and organizational best practice within the healthcare space. So we're dedicated to advancing healthcare leadership and organizational excellence by building diverse, inclusive, and collaborative relationships in the U.S. and abroad. NCHL oversees 3 premier programs, and those programs really work to provide opportunities for networking and best practice sharing through collaboration with organizations to really help achieve excellence within whatever respective healthcare development area that you're in. So our 3 programs are the Leadership Excellence Network, or LENS, which focuses on organizational development and well-being, HR, those sorts of categories. And then we have our U.S. Cooperative for International Patients program, and that focuses on international patient programs in different hospitals and health systems across the country. And then our NCAF, which is our National Council on Administrative Fellowships, again made up of graduate programs and fellowship sites that work together collaboratively, and we'll get a little bit more specific into NCAF. So NCAF began on October 1st of 2014. So we've been in business for a while, and we're made up of currently 122 members, both graduate programs and fellowship sites that are continuously working to bridge the gap between academia, what the students are learning, what they're finding out in class, and putting it into practice, whether that be in an internship or a fellowship. So we work with a variety of stakeholders, whether that be applicants to fellowship sites, students in graduate programs, fellowship sites themselves, and graduate health management programs. And we work by creating an industry standard, really in recruitment for administrative fellows, which we'll talk a bit more about when we get to our code of good practice, but also providing educational webinars and an opportunity for discussions and reading clubs and peer-to-peer learning across students and fellows. And when the opportunity does arise, we get the opportunity to develop new administrative fellowship sites or other leadership develop opportunities as they come about. So on this slide, we just have an inclusive list of all of our members currently, and this is also available on our website, and I'll drop our website and our Zoom materials for the day into the chat. So our code of good practice really came about by a means to level the playing field for all parties involved in recruitment, whether you're a student or a fellowship site, making sure that it's fair across the board. The The code is updated yearly based on changes in the field, and every NCAF organization that is a part of our membership, they agree to abide by the rules within the Code of Good Practice. The code is a part of the materials that will be sent out in the chat a little later today. Our code includes 2 recruitment cycles. So each year we usually have one cycle that runs from June to October, and then a second cycle that runs from November to the end of January. And that's included in the Code of Good Practice, as well as a formal offer date and acceptance date. So students really know when they're going to get those offers and when they can accept them by. And there's a process internally that we do to make sure that those offers are being accepted and verified, so no one is left not knowing where they're at in their recruitment, or if they have a fellowship to be accepted. The Code of Good Practice, again, allows for a unified, coordinated approach to the recruitment process, and that's really how NCAF started. It's kind of getting everyone around the table saying, what can we do to streamline the process and make sure that it's as effective as possible. And then there's more collaboration across fellowship sites versus competition, and everyone knows when the offers need to be in and when they need to be verified, so no one's having a leg up across the competition. So as a premier program of the National Center for Healthcare Leadership, NCAF is structured to have a steering committee and 2 work groups. So the steering committee, which Troy oversees, looks at membership, long-term planning, special projects, and really oversees the overall trajectory of NCAF, looking towards the future of administrative fellowships. What can we do differently? How can we change things? And then our benchmarking, metrics, and research work group oversees both the creation and the implementation of benchmarking surveys. So annually, NCHL works to survey students and applicants primarily being from our NAFCAS centralized application service, our graduate programs, our current fellows, and then our fellowship sites. And this gives us trend data year over year to see perceptions of fellows after their fellowship, where they're going next. Are students interested in fellows? Where are they applying to? All of those important details that help the steering committee kind of guide our next steps. The Emerging Leaders Advancement Work Group works to provide a lot of leadership around the educational offerings that NCAF provides, whether that be for current fellows or prospective fellows, students. And that could be in the form of our Summer Enrichment Series, which is a webinar series, our fellows leadership webinars that talks about fellows development and leadership development, or the On the Menu Reading Club that's hosted by a variety of our committee members and discussing, again, those peer-to-peer conversations on various articles or scholarly journals. So taking a look at our member benefits here, I've kind of outlined them based on if you're a graduate program or a fellowship site. Included later and included as well in the materials that you'll receive is the prospectus, which includes all of the membership benefits at a glance. But really this just sums up, you get firsthand information for your students and fellows, whether that be informational webinars that fellowship sites are hosting about their fellowship sites, or different fairs or internships that are available for students. For the graduate programs, you receive 2 NAFCAS fee waivers, which essentially allows students to apply fee-free through our centralized application service. On the other hand, fellowship sites receive access to the centralized application service to recruit fellows, have their own page to pull reports, monitor and track recruitment, and have access to applications in one centralized location. Both entities have the option to participate in work groups that contribute directly to the future of administrative fellowships. So whether that be, again, our benchmarking or our emerging leaders work groups. The biggest benefit is the networking and shared best practices that you can get from this pool of membership. Being able to interact and talk about best practices with like-minded organizations, or kind of the other side of the equation helps build out either your administrative fellowship program or helps in the recruitment of fellows, knowing how they're thinking, what they're thinking, and looking at the data. And then we also develop students and develop fellows with the learning opportunities that we have, like I mentioned before. And lastly, our benchmarking is a big ticket item for our member benefits. It allows us to see national metrics and year-over-year trends when it comes to fellowships, whether it comes to graduate programs and other stakeholders that are surveyed through those. I just wanted to share this. It's a one example of some data that we do share with our members, and it's mainly our number of sites that we share over time, and then the positions and slots. And we see that this market is constantly evolving, but this is just one example of the type of data that we can collect each recruitment cycle. So then we also have how our applicant interest compares year over year, and this is specifically through NAFCAS. So you can see the number of applications submitted, the average submitted by applicants, and it's just a helpful tool for our fellowship sites to see over time kind of where they compare across the board with other NCAF sites. So now I will pass over the baton to our NCAF steering chair, Troy Trainer. I have a few questions for you, Troy, if you don't mind.
Yeah, absolutely. So just real quick before we dive into those, by way of introduction, as Jen said, I'm Troy Trainer. I'm the Director of Women's Cancer and Specialty Services here at UPMC. I've been involved with NCAF for many years, I think back to 2015. So it's been about 7 years now, come to think of it. Both as I first started out as an applicant myself, as a graduate student, and then participated with some of their programming to now working with them in the capacity of the chair of the steering committee. So very happy to be here with you all today, and happy to answer any questions. I think Chastity, I saw a question from you pop up, and we'll be happy to answer that. So Jen, I guess take it away.
Yeah, so I guess we'll start at kind of the beginning of your NCAF experience or NCAF experience. Could you tell us a bit about being an applicant, how the NAFCAS system helped, and just your perspective from the applicant view?
Yeah, so my answer here is actually not going to be very helpful, because when I was an applicant for a fellowship site, this was before we were utilizing the central application service. So NCAF, everything was still in the development phase at that time. But for us, it was a means to really create some standardization in terms of like the timing of applications and all of that. So that was, I think, step one for NCAF. And then in subsequent years, so once I started my fellowship, I actually was able to reap the benefits of utilizing the central application service, because then we were not fielding mailed applications. We weren't fielding applications through our personal portal as an organization and then through the CAST system. So we just had one spot that we went to, and actually it was really easy for us. And just to kind of lay the land out there for those of you listening in, our organization, we have several sites and several tracks for fellowships that we utilize. And so we've been able to utilize the CAST system in order to organize that. So again, it's really easy for applicants, and it's really easy for us as an organization to tell which sites the applicants are interested in and really what tracks that we're going to be pushing them down. So
perfect. Thanks, Troy. Could you tell us a bit about if you ever participated in any, as a fellow, any NCAF related offerings, or were you involved in any capacity as a fellow?
Yeah, so as a fellow, I was able to take advantage of several of the offerings. I think first and foremost, I participated in the visit day that was at that time occurred during ACHE. So I think for me, that was my really first introduction as a graduate student to NCAF. There was a panel of folks who came in that were really, kind of leading the charge in the development of creating some standardization when it came to fellowships. And they came and presented to us at ACHE. I was really interested in then. And then they had kind of a meet and greet afterward where I was able to meet with them as well as other organizations that were interested in participating with NCAF at that time. Fast forward a few years to actually being a fellow. And at that time, I was able to participate in what then was called the Fellows Education Subcommittee, which was part of one of the many subcommittees that the steering committee had. So I was able to participate in that, where we developed a lot of the offerings that we still have today, those the lunch and learns and the chats and all of that. So that was a lot of fun to be able to participate and as a fellow, just interact with folks from across the country. I think that you're always so eager to just get involved and get to know other people, because as we know, the field is, it's national, but it's really kind of a small group of people. So it's always good to get out there and get to know everyone.
Yeah, perfect. Any advice that you would give a prospective graduate program or fellowship site that's considering joining NCAF?
Yeah, I think that, from what I've seen, both within my organization and then seeing organizations that have joined NCAF, I think the ones that are most successful are the ones that, as a graduate program, working with the students and are engaged with them in terms of, getting them out there, getting them involved in some of the programming. From a fellowship site standpoint, NCAF and really NCHL offers a lot that I know that our organization has been able to really take advantage of. But one of the things that we've seen is our fellowship directors are really involved, and they want us to, do the same. They model the behaviors that they want us to live. And so, they really kind of tapped us on the shoulders and said, here are some opportunities for you as fellows to get involved outside of just our organization. And it was through kind of their encouragement that myself and a few of my colleagues at the time really got involved in some of the various subgroups with NCAF. And so I think for me and from what I've seen from other organizations, I think of like Johns Hopkins, they have consistently really been at the forefront in participating in some of these groups. Children's Hospital of LA, they've done a phenomenal job as well. So these are some organizations that they do a great job of promoting their fellows and just encouraging them to get involved outside of the confines of their organization.
Absolutely. So last question for you, because it looks like we're coming up on time here shortly. What do you value most about being an NCAF member?
I think for me, I really enjoy, again, talking with folks from the other organizations, just hearing them and hearing their thought processes. It always helps me to maybe challenge my assumptions or the way that I'm doing things. It's just good to always have that, net out there to expand the network. So I really enjoyed that, and I found a lot of value in that. Pre-COVID, obviously, there was just a lot of in-person events that we were able to participate in, and those were just really enjoyable. We would travel to Chicago and participate in those, every fall. We would then also do ACHE and have the meetups that we had there. So it was just really valuable at that time. And then what we've tried to kind of perpetuate during the pandemic are some of these more, again, opportunities to connect, but obviously virtually. So I think those have been incredibly valuable for myself, many of my colleagues as well.
Thank you, Troy. I really appreciate your your opinion and your thoughts on NCAF, especially because you've been through so many different roles and ways through NCAF. So thank you.
Yeah. Did you want me to, I can answer Chastity's question, or did you want to answer that? How
You can go ahead and answer that. Yeah, go ahead.
Yeah, so Chastity, you asked about more details about applicants holding on to an offer. So really, once fellowship sites have reviewed candidates, they feel like they've done a thorough job reviewing candidates, they're able to offer within the date ranges that Jen had shown. And applicants can hang on to an offer technically up until the standardized acceptance date. So if I'm an applicant and I come to UPMC and UPMC offers me a position, I can say, I'm going to hang on to this offer, and I can go around and I can interview at all of the other sites that I have set up. And then once I wait to hear back if there's another offer, that's when I can make my decision. So it from an applicant standpoint, it really does reduce maybe some of that stress that they have felt historically, where if I get an offer from my site, so if I come to UPMC gives me an offer, I don't have to worry about them saying I need to know in 24 hours. The only time I have a time limit on when I need to accept or decline an offer is if I end up getting a second offer, right? I can only hold one offer as an applicant at a time. So if I do get that second offer, I have to choose between the two and let one of the organizations know that I either am accepting or declining. And then the other one, if I want to hold that offer, I can continue to do that up until the set application or the acceptance date. Does that answer your question, Chastity? Perfect.
Thanks, Troy. I went ahead and there's the meeting materials for today, the webinar materials, which includes the Code of Good Practice, as well as what you see on the screen here, the benefits that you can see for both fellowship sites and graduate health management programs. Went through this a bit earlier, but I'll also highlight that we do a bi-monthly newsletter for updates and other communications that come out of NCHL and out of NCAF. You have a national visibility through our searchable directory that students can access. And then I'll mention on the right-hand side, we do have our cross-member benefits that include access to our job board via our member portal, our competency model, our health leadership survey, and our BOLD, which is our best organizations in leadership development, the NCHL mentorship program, the white papers and other publications or research that NCHL comes out with, and then our coffee chats, like I mentioned before. Just so everyone knows, we have our graduate program and fellowship sites both pay $1,250 per year to be a part of NCAF, and then fellowship sites have that extra one-time fee to set up the NAFCAS site itself to be able to recruit fellows through that. I'm sorry, yes, there is a correction there. For new programs, both graduate programs and fellowship sites pay the one-time administrative fee. So it would be $1,750 for both graduate programs and fellowship sites. Thank you, Leanne. And if there are any other questions, we have a few minutes here that you can put them in the chat, and Troy and I are happy to answer what we can. Anything about general membership or experience, happy to answer those. So I'll give everyone a few minutes to think of some questions, if any. Don't see anyone typing here. So I will go ahead and put up my contact information here. Yes, Tiffany. Is your management residency for MHA students, or is there a specific degree that you're looking for with that program? Undergrad leadership while they're getting their MHA or MBA. Troy, you want to take that one?
Yeah, so Tiffany, we have actually a very similar structure. So we have our administrative fellowship program, which is for, you know, those postgraduate candidates. We also have a finance track and an IT track for those undergrad opportunities that we don't utilize NCAF for. So we actually do that internally and then have separate program tracks as our organization. So we really keep our, you know, just for consistency's sake, we keep all of our contact when it comes to NCAF for just those postgraduate candidates. Does that help? Or that the reason being is just they're at two different stages of their career at that time.
If there are any other questions, you can feel free to reach out either to our NCAF email or to my direct email. Happy to field any other questions that you may have about membership. Thank you for joining us today, and I hope you gained something positive out of our discussion today, and we'll follow up with each of you and make sure that any questions you have are answered. Thanks, Troy, for joining.
Thank you.